Good afternoon, this is Dr. Dao again. This video is an alphabetically listed problem of B. Today the topic is going to be on the biliary tract disease. What is the biliary tract? It's the bile system, including the gallbladder and the duct, either the bile duct from the gallbladder and the bile duct from the liver. Before I talk into the details, I like to remind you what kind of symptoms you need to visit emergency, what kind of problem you can call your physician, and what kind of problem you can manage at home in terms of this biliary tract disease. Basically, it's quite common for emergency situation because the disease could be very subtle or symptomatic, and then suddenly becomes urgent. I'm going to talk why, but what are the signs for the urgency in terms of this biliary tract? The sudden right upper quadrant abdominal pain, spasm, or spasm pain in nature, pretty much intermittently comes and goes, and actually the pain is still there, but sometimes with the waves very strong. Like a spasm and associated with nausea, vomiting, fever, or could have the skin turning yellow. So if this is the case, or may not have the whole abdominal pain, depends the cause and depends on how long you have this right upper quadrant pain. So basically, fever, nausea, vomiting, right upper quadrant abdominal pain, spasm, probably radiate or to the back of your shoulders. If this is the case, you need to call your physician or just go to the emergency room. Pretty much the bile duct, biliary tract system is inflamed. The earlier the better to prevent the perforation of gallbladder. That would be the life-threatening, very serious problem. So what is the biliary tract? So if you recall, we talked about the liver on the right upper abdomen, and some of them at the middle, across the midline. Under the liver, there's a small organ called the gallbladder. You know it. What is the function of gallbladder? Store for the biles. Okay, so basically, gallbladder has a duct, okay, cystic duct, and the liver secretes the biles through the hepatic duct from the left lobe and the right lobe, so the left and right hepatic duct, okay, and these two ducts merge into the common hepatic duct. So the liver has a bile duct, and also the gallbladder has a cystic duct. So these two ducts eventually merge together as a common bile duct. This common bile duct serves like a T-shaped T-tube, because the bile secreted from the liver flow back to the gallbladder for storage when the stomach is empty. After food intake, okay, especially for the greasy, high fat food digestion, so then the bile will secrete it from the gallbladder through the common bile duct, opening at the duodenum. And this opening called the vata is a thickening of the circular muscular structure, like to contract the close and open, dilate of the open. Ampulla, vata of ampulla. Okay, so this is the structure. And then at this structure, there's another duct, if you recall, the pancreatic duct. Pancreas secretes a lot of enzymes like the peptase, digest the protein, lipase, digest the fat, and amylase, digest the carbs. So these are all open at the duodenum. And most importantly, the pancreas secretes a very alkalinic or very basic solution, carbon dioxide. Bicarbonate, not carbon dioxide, the bicarbonate, which is the very basic solution. So this is kind of pardon me. So I just make clarify, and the duodenum open the common bile duct, drain from the cystic duct and the hepatic duct. Okay, and there's another pancreatic duct, rich of enzymes and bicarbonate. So, and then the biliary tract does not include the pancreatic duct. Okay, so just the common bile duct, which merged from cystic duct and the common hepatic duct from the left and right liver. Okay, so we know the gallbladder has reached the bile, so contain acidic, the attract calcium, especially in those obese patient or people. Okay, the calcium becomes solidified like a sandstone structure like that. You can be asymptomatic, carry that along with you until one day, one of the stone relatively large to flow out and lodge there. The things, the bile duct does not like other tracting structure like the small intestine has a lot of smooth muscle to peristalsis action, motion to squeeze things and to excrete or to move in one direction. The bile duct has the cells lining on the duct is different from bile ducts compared to the digestive tract. Okay, in the digestive tract, those cells are very flexible, can move along with the smooth muscles. The bile duct only have the cubic cells, the cells shaped the square. You can imagine the square cells usually lack of the flexibility, and there is no smooth muscle. So the bile duct just a pipe to passage for the bile to pass through, does not do anything contract or squeeze, very minimal. So that's why if there's a relatively large stone lodged there to stuck there, then the bile continues to secrete and to the gallbladder keep raising the pressure. So now is the time you feel the inflammation, the right upper abdominal pain, and if the bile back to the blood, then you will have the jaundice that's major from liver. And the liver can also happen the same way as the gallbladder cystic duct. However, it's compared to the gallbladder, because gallbladder is a sac structure with enclosed space and the pressure will rise high. If that's the case, the perforation might occur if do not go to emergency. So anyway, this is the summary, give you some introduction of the gallbladder and the biliary tract and the bile ducts and the stones, the major cause of the stones and the cystitis in terms of the inflammation. If complicated by the bacteria, that's the situation is going to be worse. So anyway, this is a very superficial introductory. The take-home message is if you have the right upper abdominal pain, spasm, intermittent, and shooting back to your shoulders, and may or may not have jaundice, fever, nausea, vomiting, don't hesitate. You probably know it, but I just remind you, don't hesitate. Just call your physician or go to the emergency room to get it out, to check it out and take it out if it's severe. Okay, so this is the video for biliary tract. I hope it helps, and actually I will see you next time. Thank you for watching.